Good morning, everyone. Sorry, we're a minute behind. I wasn't paying attention to the time. So welcome to our faculty meeting. Hopefully we'll have a few more people show up here shortly. There's another meeting that just concluded, so perhaps some people are making their way over. We'll go ahead and get started with our reflection for a minute, please. Okay, next item is review of our January meeting minutes. I believe Deb sent those out, so hopefully everybody's had a chance to look at those, and I'll accept a motion to approve those as written. Thank you, and a second. Any changes or discussion on that? Okay, if not, the January minutes are accepted as written. All right, it's always a pleasure to start with our kudos, recognizing the good work that our faculty are doing. First off, Dr. Brock Doubledy passed his pediatric GI board exam. Dr. Fernando Bola-Rudis and a colleague of his have published an article entitled Prolonged Fever in a 5-year-old Girl of Myanmarese Descent in Pediatrics in Review. Gokan just walked in. Gokan, congratulations to you and your colleagues on the article entitled Safety and Utility of Continuous Ketamine Infusion for Sedation in Mechanically Ventilated Pediatric Patients, and this is published in the Journal of Pediatric Pharmacology and Therapeutics. Doctors Liz Peck, Michelle Schimmelfennig, and their colleagues have published an article entitled A Masquerader of Disease, an Incomplete Presentation of Kawasaki Disease in South Dakota Medicine. That's actually in this month's journal. And from the research side, you will get a more detailed report, but I was made aware that Dr. Kyle Rue, who is one of the co-division chiefs for research, has been awarded a 5-year T35 grant from the NIGMS. This is one of the institutes at the NIH, to support his research on bio-ID and the nuclear envelope. These grants are incredibly difficult to come by. So as you see our colleagues out and about, please congratulate them on these achievements. Some faculty news, welcomes and goodbyes to share with you. Many of you already know this. Dr. Sita Paudel has been accepted into a clinical neurophysiology fellowship in Milwaukee, and she will be leaving to start that in June. We're not sure of what her plans are after completion of the fellowship. She has resigned her position here, but she may choose to come back. We're hoping she will do that. Dr. Kristen Berg is the Associate Director of the Center for Disabilities, and you'll be hearing hopefully more about that center today from Dr. Wendy Perrin-Johnson. But she's been appointed as an associate professor in our department. Dr. Daniel Calloway from HEMONC, he's actually been around for a few months now, but his faculty appointment didn't get done. So it's finally been done, and he's been appointed as an assistant professor in the department. And Dr. Jesse Barando, I hope I'm saying his name right, he is actually in practice in Mitchell. He's trained in adolescent medicine, and he has a general practice as well as adolescent medicine practice there. And he has been appointed as a clinical assistant professor in our department. Some updates from the medical school. They have requested that we disseminated this information to renew the SDSMA memberships that all of us have had. It was sort of an automatic for many of us before the health systems were doing that, but that's no longer the case, and so you have to actually go in and renew it yourself. I know that Sanford does reimburse us for this because I just did mine. And the reason the medical school is interested in this is because there's a close relationship between the medical school and the State Medical Association. They do fund medical education and support lots of physician causes, including advocating and lobbying for physicians at the state legislature and things like that. So this is just a request from the medical school. I've also heard from some of you that you'd like to have the opportunity to work with medical students on research and other scholarly projects. And this is a mechanism to do that. So it's actually a research program that's been developed by the medical school in conjunction with Sanford Research. It's called the Developmental Research Program for Medical Students, or DRPMS. There's the website that you see listed there. And if you want to mentor a student through a research project, I went in there and looked at it. It's actually for a student to apply, but you can see kind of how it works. And then there are also summer research projects that medical school students can work on. And I've been asked, well, if I'm interested, if I have a project, who should I send it to? And you see the name listed there. It's Laura Rumor at usd.edu. If you don't recall these, just ask Deb or me and we will direct you in getting these in. What they're asking for is, if you have a project in mind, just give a brief description. It need not be more than a short paragraph or a couple of lines on it, but that helps the students when they go in. They create a list. They're calling it the Craigslist. I think it's basically similar to a Craigslist, but it's a list of projects that are available, the faculty that are interested, and then the students can go and choose if they would like to participate in those projects. So let's keep that in mind. And then this is a save the date. The School of Medicine has a strategic planning retreat every fall. This year it is scheduled for October 10th, and the location, it says, is to be determined because it hasn't been fixed yet, but it will be in Sioux Falls. In the past they've had it in other places and people have had to take a lot of time to go there. The last couple of years they've held it at the University Center, and it's been actually pretty easy to do that. So if you can, please put it on your calendars to participate. It's helpful to chart the path for our medical school in the future. With that, we're on to our regular reports, and actually today we only have two of them because Doctors Michelle Schimmelpfennig and Joe Sajalan are gone. But Dr. Zenel will give us the residency program report.
Well, I have a very short report. Number one, thank you. We had our ranking meeting for the applicants. We'll be submitting that list later this week or next week. If anyone wants to see what the list looks like, please come visit. And the other thing is, we were the ACGME and notified us that we have continued accreditation for next year for our residency program. Whether we have citations or a letter of commendation, I'll find out when the official letter comes in the next 2 or 3 weeks. And finally, some of you will be getting an ACGME survey, and please answer it, because the higher the response rate, the better we look for the ACGME program. And that's it. Thank you.
For those of you who missed it, the rank meeting was a riot. That's all I can say. I haven't had so much fun in a long time, but it really is a fun event. And for those who were there, thank you very much for helping to rank our future residents. Without further ado, Pete is on to give us the research report. Dr. Vitiello.
All right, good morning, everybody. Just a few updates here. Kevin Francis published a review article, and hopefully you were able to catch his Grand Rounds presentation last week, because this image he focused on demonstrating the use of induced pluripotent stem cells to study rare diseases was something that was kind of at the hub of his talk. I took it from his own review article here, published in Molecular and Cellular Probes. As far as just some activities, I gave perinatal grand rounds at the University of Alabama at Birmingham. Jill Weimer presented on her gene therapy work on Batten disease at LA Biomed, which is part of UCLA. Emily Grice, who runs the is involved in running the Sanford Data Collaborative, went out to University of Pennsylvania Wharton School of Business because there is actually a sponsored project. One of the projects is out there. And Mike Coretta attended a joint conference that was on lung cancer and translational science recently as well with his research program. And one highlight from clinical research, and Kirk Griffin is here this morning, is one of the milestones is the Sanford T-Rex study that he's been overseeing, which involves kind of isolating T regulatory cells from type 1 patients with type 1 diabetes, growing them and expanding them in culture in partnership with Caladrius, and then putting them back into those patients, finish their enrollment. And you can see here that Sioux Falls and Fargo were 2 sites, and the patients that were enrolled, and 111 patients overall. So they're going to be following those patients out to the end of 2018, and hopefully be looking at the exciting results from that next year. Some awards and kudos. I know Archie had mentioned that Kyle Rue got notification that he should be receiving an NIH grant. Jill Weimer recently received a grant, though, from a foundation to continue some of her gene delivery work, specifically looking at CLN8 Batten disease patients. I was involved in a workshop with an educational group in Project Lead the Way. David Pierce was part of the Batten Disease Support and Research Association board meetings. Kirk Griffin was on a recent Canadian study section to review some kind of interesting joint-sponsored diabetes grants there. And Thane Muntz was recently in the news as the Argus leader has been following a kind of a concussion and youth football story that's been running for the last couple months, and it's going to continue to run for the next 6 months or so. Just remind you guys, Pediatric Academic Societies meetings coming up, so you still have time till the end of the month to submit your late-breaking abstracts, and certainly still get your early bird registration on. And the other thing I wanted to just let you know about upcoming events is at the end of the month here is the annual Sanford Rare Disease Symposium. So this is going to be at the Sanford Center on Friday, February 23rd. It's an all-day thing, and registration's required. You can see the link and more information there. Just wanted to highlight, we have a couple of internal speakers, as well as some invited guests, and you can kind of see there might be some things of interest to you, kind of talking about nonprofits, from people from the Children's Tumor Foundation, the Primary Cilia Dyskinesia Foundation, people talking about dystonia, FASD, and then the other thing was looking at an NIH clinical research center and identifying new genetic syndromes there. And you can see the speakers in the full agenda. But this has been an event that's sponsored mainly by CORDS, which is the Coordination of Rare Diseases at Sanford, annually. And this has certainly become an integrative conference for physicians, scientists, and families. So please go ahead and check that out for more information. Are there any questions? All right, I'll pass this back over to you then, Archie.
Okay, let's see if we can get us back. They're trying to put Dr. Perrin Johnson's presentation on, so we'll wait a minute here. Okay, so the next report actually will be part of our new business today, and that's, we call that a division report. The center is really a center, it's not a division, but it's an opportunity for us all to learn about the good work that's going on there, and then we'll have some discussion around faculty development, and I'll give you some program announcements as I usually do. Oops. There we go. There's 2 of us trying to do this. Very good. So, Wendy, if you would please come up.
Thank you, Dr. Chatterjee. I'm so pleased to be here today and to talk to you about the Center for Disabilities. For those of you who are familiar with the center, I'm excited to share some new updates and directions that we have. And for those of you that are new to the center, I hope to give you some information so that we can be a resource to you as well. So this is our incredible team of people, a lot of new faces, a lot of old faces, and this isn't everybody. We have many other staff that weren't available for this Friday. This terrific honor that we had as a ribbon cutting for our new $2.75 million grant to continue the center for 5 more years, and also because of our contributions to the community. The Chamber of Commerce did a ribbon cutting for us. There were all these people and reporters and everything. It was such an exciting event on Friday. So we were thrilled to have that recognition. And so this is some of the staff. We still have quite a few more openings that we're recruiting for right now. And just to let you know, we are one of 67 centers called University Centers for Excellence in Developmental Disabilities. Together we form a network of centers that conduct research and services, continuing education, interprofessional education to impact our state and also to provide the information to influence policy at the federal level. And so we're funded by the Administration on Intellectual and Developmental Disabilities in terms of, maybe we're authorized under that, the DD Act, and our funding is through the Department of Health and Human Services, the Administration on Intellectual and Developmental Disabilities. So our exciting new core grant that we have here, we have 5 new goal areas, if you will, to how we are organizing the work that we're doing going forward. One is around social capital, relationships, supported decision-making, self-determination, self-advocacy, because we went around and we did an extensive needs assessment in all of our communities around the state. We talked to people. We used a lot of ways to collect data. And the biggest thing people said that was an issue for them is relationships, connections, those social networks that we know are so powerful for our health, for our well-being, and for employment and all of those things. So then lifespan transitions, looking at not only from early childhood and then school to adulthood, but also we're moving into the area of aging. So what does it mean to have a disability and move into and aging, and how does your life change then? Rural and Native American communities, we have a big focus in that area. Looking at Indian self-advocacy, how can you be a spokesperson for yourself, accessing services in the world, but still maintain true to your culture? And we have a Native American from Pine Ridge who is leading that work that we're doing in that area, as well as some of the workforce development needs in those communities and cultural awareness training. Workforce development, this is looking at training across many, many disciplines with education, employment, early intervention, mental health, looking at both practitioners, so it's professional development opportunities, as well as pre-service and clinical kinds of training. And then impact evaluation, we have a whole 5 years really focused on how can we better look at how the work we're doing is impacting people. What is it doing for their lives? How is it making things better? But looking at a methodology that's very effective. We've been starting to work on that, and we're looking at something that will benefit our center and also state agencies, but also be a national influence. So one of the goals of a USED, which is what we are, is to leverage other dollars. And that's one of the missions that's written into legislation. So we're really excited because last year we are able to bring in 21 grants, almost $6 million, which allows us to move in a lot of different directions to address these needs that, that our state has. And so we've been able to diversify that funding, and that's, I think, one of the most exciting things to me. We've moved into foundations, Special Hope, Kessler Foundation, National Endowment of the Humanities, a lot of different federal funding sources such as NIDLR and education. So it's allowing us to really expand our work scope and things that we're doing. So far this year, we've already submitted 2 more that we haven't heard from yet, and we're working on a big $5 million grant right now with 4 other states. So for many of you that are familiar with this center, we have a change with the new grant and our new activities and how we're organized. And I just wanted to introduce you to 2 of our new assistant directors, because you'll probably have some contact or interaction, and I hope you will, because they're just amazing. We have Dr. Richard Kiefer O'Donnell, who was with the USET in Alaska and came here, and Dr. Kristen Berg from Temple University, who is involved with the LEN program in Pennsylvania. So we're set up with a management structure, and many of these people you're familiar with the different departments, if you will, or divisions within our Center for Disabilities. But the way that our staff are organized now, just so when you're coming, if there's something that you're looking for, it's by teams. So we have teams around topical areas that match our work scope from the core, the center grant, as well as our website. So we're looking at some of the same areas, and many of our projects fit under there, but these were some of the priority areas. The transitions across the lifespan and behavioral health and rural communities, these are the kinds of things that we're organized by. So it's really building a lot of teamwork around very similar projects and allowing us to expand in those areas and work with our community partners too. So I wanted to highlight some of the key areas here. This by no means is everything that we do, but I thought that these might be some relevant things that would be of interest to you. We are here to hopefully be a resource to you. So if there's things that could be a benefit, I don't know that we can address right away, but we certainly put it on our plate and work in that direction to try and help you with that. So one of the big areas we do is interprofessional education. So we have pre-service programs, our LEN program, which is a multidisciplinary trainee program for graduate students, and we have 21 trainees. The significant thing about that now is we've added well, we've always had a parent trainee, but we've added 2 self-advocates. So 2 people with disabilities are participating side by side with the other trainees and going through the whole program. The Rise Up, which is underrepresented undergraduate students that come and spend 8 weeks with us for the summer, focused on public health. We were just funded for another 5 years for that project. And then we teach a lot of courses down with health sciences, down the interdisciplinary, disability services minor, and some autism courses. We have created an adolescent health modality, transitions of care coordination, and we've been fortunate to build that with the help of the pediatric residents who have participated for 2 days during their month rotation. We also have extended that to Augustana and the genetic counselors as part of their training program. And then we just have moved on to nurses, and this year we've applied that model with the nursing program, who are working with us and been training them in those areas. So we have student opportunities for research and internships. We have 2 social work now and 1 education student. These are opportunities that are available. We have a lot of research, a lot of data, a lot of opportunities for those things. So if people have an interest, they can participate. And then we do a lot of continuing education so that we're meeting the needs of the community. And some of these are online courses. Some of them are presentations, trainings, things like that, that people can get university credit for in addition to CEUs or anything like that. So in our clinical and other services that we provide, we're not a direct service entity, but we do provide some services, and those are clinical. Many of you are familiar with our autism and fetal alcohol syndrome and our developmental disability diagnostic clinics. We operate those here, and fetal alcohol is also in Rapid City. We have our transition and action clinic, which is looking at healthcare transition and integrating education, employment, and independent living in that. We were working with students that were, or youth that were 16 to 21. We've expanded that to 26. And now we're looking at a rural model using telehealth where we can connect to those communities to engage them into this process. So we do some services, and last year we served almost 700 families and children with our birth to 3 early intervention services that we do in our deafblind support that we provide, and that goes up to age 21. The new part that may be of interest is our behavioral services. We've gotten multiple grants in that area because that was the other greatest need that we heard out in the state is we need behavioral services, we need mental health services, we don't have crisis interventions assistance, particularly for people that have a developmental disability and are dually diagnosed. And so we have grants that are looking at school-age youth and also adults, and we've hired, well, we're still hiring more, but we have 8 new staff in that area to deliver those services. So we're also looking to develop a certificate program and use that as an education component as well. We provide a lot of technical assistance around the state. We've really gotten more efficient with how we do that. So we're collecting the data, and then we look at what those needs are, and collectively, is it a regional area that we need to go in and provide some different services, or is it statewide that we do some training or direct it in another way? We used to just run out to every request that we had, and now we look at it in a larger capacity to try and build that. The one thing that I've heard loud and clear from everybody, and actually was in this room previously, was we do not have clinic capacity to meet the need. And we're looking at how we can expand that in a very aggressive way to try and approach expanding our services. So we are looking at building our capacity for staffing. We're conducting some training, some more and more people in our office, and hiring some additional, like a clinic manager who can assist us with expanding those services, because we hear a need for screenings and other areas of diagnostic services. So we are really paying attention to that and trying to figure out the best way that we can do it and gradually moving in that direction. The other thing we're looking at is how we can obtain third-party billing. We've been in a lot of conversations, and we're really moving on that, because right now it's either the agency that refers pays or it's self-pay, and so it's very limiting to the number of people that can benefit from our interdisciplinary clinics that are very unique for the model that they offer. So we are really putting that on a priority level because of the feedback that we've heard from everybody, particularly here. The Native American collaborations that we have, working very closely with a lot of the tribal colleges in the state. We have actually 2 grants that we wrote together with Sinta Gleska University. So a lot of it is around cultural awareness training, disability advocacy training within cultural perspective. And we are looking also to meet some of the vocational rehabilitation needs that they have, developing a university-based program that can go regional and then statewide to create the personnel prep program that they need to address the tribal VR program needs. The state has just recently contracted with us to do cultural awareness training for all state employees. That's close to 8,000 employees, and this is something that we're going to do all year, but then they want to keep a component of that going after that each year, which will be a really nice way to bring this information into the state. We also have a LEN trainee who comes from Sinta Gleska, and one of our discipline heads is a faculty member down there. And then we include in our symposium, we have a whole series, Native American series, so we have a very large turnout in it, and it's become so rich in the discussion and the interaction of everybody that's in attendance. Just to give you an idea, our mission is to do this work, but then to translate it into practice and into policy. So we develop a lot of products. We're still working to develop more, but how can we make information, research results, usable information in a way that people can benefit from that? So we're using a lot of different modalities, technology, webinar. We just got a new grant to do real-time texting, so just-in-time employment, so we can get that information out to people in a minute when they need it. Providing webinars and some written products, and this is the Possibilities is our newest publication that is stories of people who are successful in South Dakota, but not just their success story. How did they get there? What was the blueprint? How did someone in a different area with a particular disability lead a quality life at this point? And so everybody can benefit from learning that. In our newsletter, we do a lot of presentations, national, international, in Northern Ireland and Tanzania this year. So we're represented in a lot of different areas and trying to get that information to a variety of audiences. Okay, so now just some highlights. We were fortunate enough in a competitive grant process through the U.S. State Department to host a fellow, the Americans with Disability Act Fellowship, and he was from Tanzania. He was here last May for a month. Some of you might have met. Good luck. And in December, we were also awarded the Outbound program, so I was able to go to Tanzania and work with the school systems and the local governments there to help improve their educational services. And we're still continuing to work together and looking at long-distance education, which we're going to have a webinar coming up in the summer, where we can participate in the training opportunities with them and continuing to support those services. But we were just, the exciting thing too is we were just awarded another grant from the State Department for another fellow this year, and this one will be focused on employment. This one was inclusive education. So it's such a nice experience to be able to learn from the other countries and for them to come and benefit from our knowledge and work. Our symposium, which I hope some folks here would be interested in coming. This is an opportunity. We've been doing it. This is our 4th year. Now we're getting about close to 300 people attend. We bring a lot of national keynote people in, but the focus is on highlighting the work of the center and how people in the state can access that. And so we do a lot of integrated types of practical, hands-on, and informative sessions. We partnered last year with the Self-Advocates for Change, which is the self-advocate group for people with disabilities in the state. So we had a large presentation from them. And then this year, the Business Resource Network was also a partner last year, and the National Disability Employment Awareness Month, it's NDAM, it's a group that organizes that in the state. They are going to partner with us too and work to bring the employment piece in. So it's been a really nice way to bring people from all different walks of life together and have those opportunities to interact. And that's the whole focus of this, to build the social networks and the capacity of people in the state. So one of the new things that we've been working on, the Transition and Action Clinic has been very effective so far with our data to really provide that one-day experience for people to help plan that transition to adulthood. But that's what we want is a more sustainable model. This clinic is being replicated in other states, but we wanted to look at other options. So we built a transition consult that we're just in the process of testing. That's a 2-hour modality that we're also using it as a teaching opportunity, and you can see the students there. We operate out of the Perry Center and using different individuals to to gain that knowledge of being able to work with people with disabilities in helping them enhance that transition to adulthood. And so we actually are just moving now into the dental area, working with dental hygienists to be able to be more trained in that area. So I think this is a really upcoming, exciting prospect, but it's very early on right now with our data. But we're looking to build that 2-hour consult and look at the longitudinal outcomes as a result of that. And we do have some measures on the skill set or the knowledge level of the people that are conducting the consult, but now looking at the benefits of the people that are participating. So just some events that may be of interest to someone. We are trying to do more larger statewide events that address some of those technical assistance needs. We're doing the Special Education Conference in March that is focused on educators. And then we have the Educators Institute. This came about because the School of Education wanted to impact the practitioners that were already out in the classroom. And so we're collaborating with them. We piloted it last year, and it worked very well, and we got a lot of good feedback. And so this year we're doing it with also the Transition Services Liaison Project. So I anticipate that being an annual event that we do over at the University Center. And then a new area, because we've heard so much of a need in this, is early childhood mental health. We're putting on a 2-day event here in Sioux Falls in September. There's a lot of collaborative partners and some national speakers coming in for that. And then our symposium in October, October 21st to 23rd. I hope that some of you will be able to come, and there'll be more information on that very soon. And the last thing, I wanted everybody to be aware, our network that I mentioned in the beginning, AUCD, which is the association of all of our centers, they are having a gala, and it's focused on state policy, and our governor is being awarded and honored there because of the work that he does in the area of disability and the impact on our state policy. He's done some amazing things that promote quality of life for people with disabilities and works collaboratively with us on quite a few things. So we're really proud that he is getting that honor. And that's it. So any questions, comments?
So as you saw, there's a great deal of work that's going on at the Center for Disabilities, and if you have patients that you'd like some help with, certainly connect with Dr. Perrin Johnson and her colleagues, or if you have questions or comments, please do that as well. For faculty development, we'll talk in a little bit of detail about our Grand Rounds program. The pediatric writing group has gone virtual, and so if you have pieces of writing that you'd like an internal review on, please submit those. Jody Huber runs that group, so she will be able to help you get those reviewed internally and give you some feedback to improve your writing. The writing workshops are archived. I'll show you where that is here in a minute. The South Dakota Medicine Primers Series continues, and this is a terrific opportunity for our faculty to submit short review articles. They are peer-reviewed. South Dakota Medicine is indexed in PubMed, so I encourage everyone to try and submit some of these articles. And then those of you who go to Rapid City to do outreach, there's an opportunity to do Grand Rounds there. If you're interested, please contact Dan Peterite. They do pay a small stipend for that. Our Grand Rounds program is overseen by Dr. Maher, and really Betty makes sure we dot our I's and cross our T's and make sure everything is correct for that. Through the efforts of the Grand Rounds Committee, Dr. Maher and Betty, we have speakers now scheduled through November. I think Betty's got one spot open in November. She's nodding her head back there. Last January, the CME credits started to be offered by Sanford instead of the medical school. We had some initial problems, but it seems like those credits are being awarded correctly now. We do need people to complete their CME documentation, conflicts of interest, objectives, those kinds of things. When Betty sends you emails, please respond to her. We have external speakers, and Betty tells me she has very little trouble with them, and our own faculty, sometimes she has to remind several times, so please do try and turn in those documents. Some upcoming speakers and topics. Next week, we have a speaker from Mayo Clinic, Dr. Anita Mahajan, who will be talking about proton therapy for pediatric cancer. And the week after, one of our own residents, Francesca McCaffrey, will talk about the 7 great advancements in pediatrics, past, present, and future. If you have recommendations for a speaker for Grand Rounds, please contact Betty. Do not extend invitations to speakers on your own. We do not have funding available. We've run into that problem in the past where people have said, oh, this is a great speaker I heard, I think I'll invite them. And then we discover we don't have funding for that. So just be careful about that. We do have some limited funding. We can sometimes figure out a way to bring a speaker in. Just let us know ahead of time. And that is actually Teresa Fry giving her Grand Rounds a couple of weeks ago on pediatric rheumatology. This is the Scholarly Activity Board in the clinic. This is where we display the posters that were presented last year at our Research and Scholarship Day, and Jen Panning changes those out. She sends people who have presented posters last year requests to submit their posters for display, allows the people in the clinic to see the work that's going on, and maybe hopefully build collaborations. On her own, Jen started adding other things onto that board, so some of these things you're seeing are actually publications from our faculty. So if you want people to see what you're doing, just send them to Jen and she'll get them on the board. I mentioned the writing group already, so we'll skip that. These are the writing workshops. These are archived. They're actually several years old now. One of the things that the medical school has done is move these things out from behind the portal. Excuse me. You used to have to sign into the website in order to get at that. Now everything is in front of the portal, so most people can access it pretty much from anywhere. This is an event happening at my home tonight. This is the Women in Medicine and Science sponsored mentoring event. We have students that the faculty mentor, and both faculty and students are invited. If you haven't RSVP'd, come anyway if you'd like to come. It's at 5:30 to 7:30. It's a great opportunity to meet our wonderful students and to have that opportunity for them to meet you and learn about the good work that you're doing. I think Pete mentioned the Sanford Rare Disease Symposium. This is February 23rd, and again, everybody's invited to go to that. The Perinatal, Neonatal, and Women's Health Conference is in March. That's March 29th. I think it's supposed to be here at the Schroeder. Yep. And then this is our Research and Scholarship Day conference coming up May 17th. The call for abstracts for this conference is out. For those of you who are familiar with this, you know that you can submit abstracts for posters that you have either presented in the last year or are planning to present, or if you just want to present it to this conference, it's fine too. We have a keynote speaker, John Cunningham, who will do the special Grand Rounds that day. And then that is shortly after, followed by our poster session. In past years, we've had good attendance and a number of posters that are submitted. I believe this year we've had only one abstract submitted so far, Deb. So Deb will be sending out those reminders. Please talk to your colleagues, the students and residents who have been working with you to submit to this conference. We take pretty much anything that has to do with child health. It need not be a hypothesis-driven research project. Could be an unusual case report or something like that. The only thing is that we do not allow anything that has commercial interest to be presented. That's our only restriction for the posters that are submitted to this conference. And with that, I do not have anything more for us to talk about, but certainly this is an opportunity for you all to bring up issues or concerns or questions that you have. Everybody stay warm. Thank you for coming. Bye-bye.